Thank you to our nurses and heroes for sharing their on the ground experiences with COVID 19. Their stories are a perfect example of why all healthcare facilities must be prepared, not only as a responsibility of the employer to provide a safe and healthy workplace, but to stop the spread of this global disease to protect public health. My name is Jeff My name is Jane Tomlinson, and I'm an industrial hygienist for the National Nurses United. My job is to identify and mitigate conditions in the workplace that harm nurses, protecting nurses in turn to protect patients and our communities. The results of our national survey of more than 6,500 nurses is truly disturbing. They show that large percentages of the nation's hospitals unprepared to safely handle COVID 19. Here are just a few highlights. Only 27% of nurses responding report that there is a plan in place to isolate a patient with a possible COVID 19 infection. 23% of nurses report that they don't even know if there's a plan in place. Many nurses either don't have access to necessary personal protective equipment, the PPE that you heard about already, don't have enough stock on hand, or haven't even fitted and trained on how to properly use PPE. Only 63% of nurses responding to our survey had access to N95 respirators on their units. Only 27% had access to PAPRs, the powered air purifying respirators, the higher level of protection that we are recommending. Only 44% of nurses report that their employer has provided them any information about COVID 19. As Bonnie Costello explained, the nurses that follow the precautionary principle because they are patients' advocates and also because they are scientists, nurses, understand how diseases spread. Vigorous infection control means that you always take the safer route. You opt for higher level of PPE. You adopt higher standards. Sadly, our federal government agencies have not followed this principle in their approach to containing the virus. And now we are reactive when could have months ago been proactive. In recent days, just this morning, we have heard discussion about the Center for Disease Control and Prevention, the CDC, weakening their guidance even further, including recommending surgical masks instead of respirators for nurses providing care for patients with COVID 19. NNU, National Nurses United, is opposed to these changes. We have ample scientific evidence that this is the wrong step to take. For example, this is the only portion of the SARS Commission report from 2006 that clearly and explicitly states that the use of surgical masks instead of respirators did not protect nurses from SARS, which is similar to coronavirus to SARS-CoV-2, which is the virus that caused COVID 19. Many healthcare workers in Canada and around the world were exposed, infected, and some died, and many brought the virus back home to the families because of lack of protection. Now is not the time to weaken guidance. Now is the time to use every possible tool available to guarantee the highest level of protection, guided by the precautionary principle to prevent the spread of infection, to protect healthcare workers, and to preserve our capacity to respond to a potential widespread outbreak. National Nurses United has written to multiple agencies, including Presidential Administration, all members of Congress, and the CDC, asking them to step up protections. Just yesterday, we petitioned the Federal Occupational Safety and Health Administration, OSHA, to adopt an emergency temporary standard immediately on emerging infectious diseases because currently no such enforceable standard exists nationally. California, through Cal-OSHA, has the Protective Aerosol Transmissible Diseases Standard, which must be thoroughly enforced and held as model to ensure that our nurses, other healthcare workers, their patients, and communities are safe. We are continuing to monitor agency actions closely and look forward to working with the local, state, federal agencies to implement our recommendations, the nurses' recommendations, to combat COVID-19.